Millions of people undergo CT scans, MRI scans, mammograms, and ultrasounds every year. A CT scan uses X-rays to create detailed cross-sectional images of the body. An MRI uses powerful magnets and radio waves to produce highly detailed images of soft tissues. An ultrasound creates images using high-frequency sound waves, while a mammogram is a specialized low-dose X-ray designed to detect abnormalities in the breast. These technologies are incredibly powerful for finding tumors, but here's the surprising part. None of them can definitively tell whether a tumor is cancer. Two masses can look almost identical on imaging, same size, same shape, even in the same organ. Yet one is completely harmless while the other is an aggressive, life-threatening cancer. So who reveals the truth? The answer lies not inside the scanner, but under a microscope. Histopathology remains the gold standard for cancer diagnosis. After a biopsy is taken, the tissue follows a carefully controlled journey. First, it is preserved so the cells do not deteriorate. Next, it is embedded in wax to make it firm enough to cut. It is then sliced into sections only a few micrometers thick, about 1/20th the thickness of a human hair. These slices are stained with special dyes to make different cell structures visible, before finally being examined under high magnification by a pathologist. Why all this effort? Because the microscope reveals details that no imaging technology can see. A pathologist carefully studies the size and shape of cells, the appearance of their nuclei, which contain the DNA, how frequently the cells are dividing, how the cells are arranged within the tissue, and whether they have invaded surrounding structures. Each of these microscopic clues provides important information about the nature of the tumor. Together, they reveal not only whether a tumor is benign or malignant, but also how aggressive it is likely to be. Benign tumors generally resemble normal tissue. Their cells remain well organized, grow slowly, stay confined to their original location, and rarely invade nearby structures. In many cases, they pose little danger beyond compressing nearby tissues. Malignant tumors behave very differently. Their cells lose their normal organization, their nuclei become enlarged and irregular, they divide much more rapidly, invade surrounding tissues, and eventually may spread to distant organs through a process called metastasis. It is this ability to invade and spread that makes cancer life-threatening. But modern pathology goes far beyond simply looking at cells. Today, pathologists combine microscopic examination with molecular testing to understand the biology of each individual tumor and help doctors choose the best treatment for each patient. One of the best-known examples is HER2 testing in breast cancer. HER2, which stands for Human Epidermal Growth Factor Receptor 2, is a protein found on the surface of breast cells that normally helps regulate cell growth and division. In about 15 to 20% of breast cancers, the HER2 gene becomes amplified, causing cancer cells to produce excessive amounts of this protein. As a result, the cells receive constant signals to grow and divide, making these tumors more aggressive. Fortunately, identifying HER2-positive tumors allows doctors to prescribe targeted therapies such as trastuzumab, a drug that specifically blocks the HER2 receptor. Instead of attacking all rapidly dividing cells like traditional chemotherapy, trastuzumab targets one of the main biological drivers of the cancer. Without HER2 testing, doctors would never know which patients could benefit from this highly effective precision therapy. Another important marker is PSA, or prostate-specific antigen. PSA is a protein produced almost exclusively by normal and cancerous prostate cells. Sometimes a patient develops metastatic cancer, but doctors cannot immediately determine where the cancer originally started. In these situations, PSA staining acts like a molecular fingerprint. If the tumor cells stain positive for PSA, pathologists can confidently identify the prostate as the site of origin, even if the cancer has already spread to bones, lymph nodes, or other organs. This information is critical because treatment is based on the origin of the cancer rather than the location where it was discovered. Pathologists also measure Ki-67, a protein found only in cells that are actively dividing. Think of Ki-67 as the tumor's speedometer. A low Ki-67 score means relatively few cancer cells are dividing, suggesting a slower-growing tumor with a generally better prognosis. A high Ki-67 score indicates that many cells are dividing simultaneously, reflecting a rapidly growing and often more aggressive cancer that may require more intensive treatment. This single marker helps doctors estimate how a tumor is likely to behave and plays an important role in selecting the most appropriate therapy. Together, HER2, PSA, and Ki-67 demonstrate how modern pathology does much more than simply diagnose cancer. HER2 helps determine whether targeted therapy can be used, PSA identifies where a cancer originated, and Ki-67 predicts how quickly a tumor is growing. These biomarkers transform pathology from a purely diagnostic specialty into one that guides truly personalized medicine. Perhaps the most striking demonstration of pathology's importance comes from one of the most common reasons people visit a breast clinic, a breast lump. On a mammogram or ultrasound, two breast lumps may appear almost identical. They may have similar size, shape, and even similar imaging characteristics, making it impossible to confidently distinguish between them based on imaging alone. Yet when examined under the microscope, they can represent two completely different diseases. One may be a fibroadenoma, the most common benign breast tumor, particularly in younger women. A fibroadenoma is not cancer. It consists of normal breast glands and connective tissue that have simply grown in an organized, non-invasive manner. The cells closely resemble healthy breast tissue, remain confined to their original location, and never invade surrounding tissues or spread to other parts of the body. Many fibroadenomas require nothing more than routine observation, while others can be removed with a simple surgical procedure if they become large, painful, or continue growing. The long-term outlook is excellent. The other lesion may be invasive ductal carcinoma, the most common type of breast cancer, accounting for approximately 70 to 80% of all breast cancers. Unlike a fibroadenoma, these cancer cells lose their normal architecture, develop enlarged and irregular nuclei, divide rapidly, and invade the surrounding breast tissue. Once they penetrate lymphatic vessels or blood vessels, they gain the ability to spread to lymph nodes and distant organs such as the bones, lungs, liver, or brain. Although two breast lumps may appear remarkably similar on imaging, their microscopic appearance, and therefore their treatment, is completely different. A fibroadenoma may simply be monitored, whereas invasive ductal carcinoma often requires a combination of surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, or immunotherapy depending on its molecular profile. This example perfectly illustrates why histopathology remains the gold standard for cancer diagnosis. Imaging tells doctors that a mass exists. Pathology tells them exactly what that mass is, whether it is dangerous, where it originated, how aggressive it is, and which treatment offers the greatest chance of success. In the era of precision medicine, the microscope has become far more than a diagnostic instrument. Combined with molecular biology, pathology guides personalized treatment, predicts prognosis, prevents unnecessary treatment for benign conditions, ensures aggressive cancers receive timely therapy, and ultimately improves patient survival. Behind almost every successful cancer treatment is one crucial step, an accurate diagnosis made by a pathologist looking through a microscope. Sometimes, the most important decision in cancer care begins with a single slide of tissue under a microscope.